You're listening to Insurance Matchmaking, your path to health, life, and Medicare coverage with Matt Libby Insurance. And now, sharing his knowledge, here's your host, Matt Libby.
Good morning. Welcome back to Insurance Matchmaking. We're off to a great start this morning. It is cold. It is fall now. Autumn is here. And I just realized I was telling my producer as we got started here, as I cleared my throat, realized I didn't bring my coffee that I had sitting on the counter to bring. I don't know if I left it in the car or I left it at home, but I don't have my coffee, so I'll be all right. We'll troop on through. But it is AEP, as we call it in the Medicare insurance field, the annual enrollment period. We can now officially enroll people in a plan. We've had a busy couple weeks already this month, meeting with new and existing clients, reviewing their options and going over, okay, this is the plan I recommend for you. Sorry, can't enroll you in it today. Come back after the 15th. So I've got a couple people that are coming back and doing that. And I haven't done that much in the years past. So this year's, I'm feeling optimistic that it's going to be a good enrollment year. There are so many changes in the Medicare field this year on the Medicare plans. It really affects everybody. And I don't know. I know that it's an impulse, kind of like when you're in the store. Can I help you? No, I'm just looking. And people say, "Oh, I'm good. I like my plan." Great. I love the fact that you like your plan. You still need to check it. There's so many differences going on this year, and the biggest one, and I've talked about it on here before, but I've got some more information since now we're getting into the enrollment time, and so some of the stuff that I couldn't share before I can now share, but also things that I am learning about how the drug plan's working, and I'm still a little confused, but hopefully we'll get you a little closer. But the Inflation Reduction Act was passed in 22, and one of the big changes that's taking effect, I say taking effect this year, is really taking effect in 2025, but it is taking effect on what plans you pick this year for 2025, and that is there is a $2,000 maximum on your Part D, almost said B as in boy, Part D as in dog or as in drugs. There's a $2,000 cap on your prescriptions. If you got some really expensive prescriptions, somebody's got to pay that, and it's 70% of that's left over that has to be is going to be paid by the insurance company. And people think, well, no biggie, the insurance company, they got lots of money, they can pay it. Well, insurance companies are in the business to make a profit. And if they're not making any profit, then they're going to take steps to figure out how they can still provide the service and make a profit. One of the things that's really got our agents in an uproar, and I probably talked a little bit about it, and it's not just one company. The one that has it really in uproar, and I'll go into that, but a lot of the companies have made the drug plans non-commissionable. A lot of their plans, they're like, one company has just decided they're only going to have one plan, and it's non-commissionable. So it doesn't do us any good to move you to that plan. Or everybody should have got what's called your annual notice of changes. You're supposed to get that before the end of September. It used to be they would send them out about the second week of September because they wanted to know what they were adding to the plans for the next year and say, and be able to say, oh, look, your maximum out of pocket went down. Your premium was lowered. We've added and I'm talking a little bit Medicare Advantage. We've added more dental benefits. We've added more over-the-counter. None of them are doing more this year, basically. They're doing less. They're trying to figure out ways to absorb those extra costs. So maybe your dental benefits went down on your Advantage plan. Maybe you had over-the-counter before, and now you're not having it, or it's less. Or in fact, actually, I've got plan I'm on, used to pay 100% of the dental coverage. I now have to have a 20% cost share on the plan that I have. I still have the same maximum allowance, but I'm going to pay some of the cost. So if I get a filling or if I end up with a root canal, I am going to have to pay some of that cost, which is still not terrible. A lot of the standalone dental plans I sell don't even cover 80%. So it's not bad, but it's a little frustrating when you find out, my benefits just went down. But on the drug plans, as I mentioned, a lot of them are going to no commission for us. And the reason that's really an irritant, we never made a lot of money on a drug plan. But reviewing our clients' prescriptions is probably where we spend the most time, especially if it's an existing client. If I've already explained to you what's the difference between a Medicare supplement and a Medicare Advantage, when you turn 65, you signed up for a plan following my recommendations, I don't have to go through that education process again, which is very time consuming on that first go around. After you've been on a plan, now we're just kind of talking about, we're going to compare this plan to this plan. The hospital copay on this plan is $300, but on this plan it's $295. Not a big difference. Or actually, there's a few plans out there now that how many days in the hospital you have to pay that copay has gone all the way up to 8 days. Most of the plans were doing like 5 days. So again, they're finding few ways that they're going to pick up a little bit of extra cost sharing from you to help offset some of those other costs that they're paying. And plus, healthcare costs in general always go up. So they were always fiddling around with the numbers to figure out the best way to still give you good coverage and not lose a bunch of money. The other thing with the drug plan, we had one drug company out there. When I say one drug company, one insurance company that has a drug plan just decided they're not going to pay commission on any of their plans, and we expected that. We've seen that with other companies. But the one thing they did that was different from everybody else, they decided they're not going to pay us our renewal commissions on those drug plans. And again, they're not much, but it still helps kind of feel like, hey, at least I'm getting something for my time because I'm going to get my renewal on this because I'm recommending you stay on the plan you're on. Or I move you to another plan. And again, we get the same commission on a plan. If you're already on a plan, we get the renewal rate if we move you to another plan. We don't get that in this company. If you're my client, you know what company I'm talking about because I probably put you on that drug plan. It's the least one out there. Very low premiums, great one of those plans to avoid that late enrollment penalty for Part D. If you don't get Part D when you're first eligible and sign up later, then have the late enrollment penalty because you don't take any prescriptions. It was a great option for everybody. It's still a great option for you if you don't take any prescriptions, but you want to avoid that late penalty. It just doesn't do anything for me. So we're not real happy with them as agents. But we will still, Matt Libby Insurance will still recommend what's best for you, but I'm also going to tell you, I can't sign you up on that plan. I am not appointed with that carrier. I did not renew my contract with them. I'd already done my certification with them for next year, and then they sprung the no commission thing on us. And by the way, we need everybody to re-sign a new contract. Well, I'm not agreeing to that contract, so I'm not doing it. And I don't say it's not being just spiteful. There's some other reasons why I'm not signing that contract. But if that plan's the right plan for you, I'll have to give you an 800 number, or you have to contact Medicare yourself to sign up for it. I can't sign you up on that plan. But the other thing is really unique on the Part D changes. I mentioned that $2,000 maximum out of pocket. The interesting thing is, it still doesn't mean you have to spend $2,000. And this is the part where it gets tricky, and even explaining it's going to be kind of hard. I do not know the formula. Don't ask me how to figure out. I have tools that, I say tools, software, where I put in what prescriptions you take, what the dosage is, how often you refill it, what pharmacy you use, and then search that against other insurance carriers. Which one's going to be the most economical? That will be the most economical for your coverage. And what happens on that is you have deductibles, you have copays, you have your tier levels of the prescriptions, and also what I mentioned, the pharmacies. You have standard and preferred pharmacies. Most pharmacies are going to be in network with pretty much every drug plan. There's a few exceptions, and usually it's because the insurance company doesn't want to deal with that pharmacy, so they won't make it as in network. Most of the time, most pharmacies are going to be in network, but they're probably standard pharmacies. If they're a preferred pharmacy, that's the pharmacy the insurance company wants to do business with. You're going to get better rates, better copays, or less costs on your drug if you're using that preferred pharmacy. So that's why it makes a difference between standard and preferred. And a lot of times, most people, it doesn't make a big difference. It might be, instead of having a 0 copay on a tier 1, you have a $5 copay. or a tier 2 generic, a little more expensive generic, you might have a $10 copay instead of a $5 copay. So a lot of times those differences aren't a big deal, but when you have a lot of prescriptions, it does add up. The other thing is I mentioned the deductible. In 2025, the Part D deductible, that the max it can be is $590. Most drug plans, and also that includes Medicare Advantage plans, will have that $590 deduct, or can have that $590 deductible. And in some plans it'll be less. Sometimes it doesn't apply to Tier 1 and Tier 2. I've actually seen one that was Tier 2 and up, so it didn't apply to any of their Tier 1, but it did apply to Tier 2. And in some companies will put in what they call Tier 6. And Tier 6 is counterintuitive because we always teach everybody Tier 1 is your lowest cost generic drugs, Tier 3 is your brand name, Tier 5 is your most expensive specialty drugs. So Tier 6 should be really high. No, a lot of times, some plans, that's the tier that they put all that will be a zero copay on. That's the tier they put their $35 insulin on. All plans have to have a max cost $35 insulin, but they don't have to cover all insulin for that. It still has to be on their formulary. So we run into some people take Humalog, some people take Humulin, some take Lantus. So it depends on what insulin you have, whether it's covered in the formula. And that's the other part that gets sticky. That $2,000 maximum, the prescription has to be on that carrier's formulary. So if it's not on there and it's a real expensive drug, you're just going to pay out of pocket, and there is no out-of-pocket protection on that. You will pay the max. So that's one of the reasons I say you need to check your costs. You can do it yourself, but most people like a little bit of help on that, and that's something we can help with, and we still do that as a free service. We hope to be able to enroll you in a plan that we can get paid on, or you may have some other insurance needs that we can help you with, and also that's how we build our referral base. So even if we're not going to get paid for the plan you're getting, that's part of the service we give. So let us know if we can help you on that. And we're coming up close here to the break, so I'm going to talk a little bit more about how you can get some of those where we can help you. And we're going to talk a little bit more about these prescription drugs after we come back from the break.
Hi, this is Marvin Long, your local Twin Lakes Business Solutions consultant. As fall kicks off and football season heats up, it's also prime time to score big with Twin Lakes Fiber Internet for your business. Enjoy lightning fast gig speeds, priority service, and top-notch local tech support. It's the ultimate game changer that will amp up your team's efficiency and ensure your customers get an unbeatable experience. Give me a call today at 931-476-2151 or visit twinlakes.net to explore the winning plays Twin Lakes has for your business.
Looking for incredible deals and unique finds? Discover the Habitat Restore off South Jefferson Avenue in Cookeville. From furniture and home decor to appliances and building materials, we've got everything you need to spruce up your space, all at unbeatable prices. Plus, every purchase supports Habitat for Humanity, helping families build their dream homes right here in our community. So why wait? Visit Habitat Restore today and uncover treasures while making a difference. South Jefferson Avenue, right here in Cookeville.
And now, back to Insurance Matchmaking with Matt Libby Insurance.
All right, welcome back to Insurance Matchmaking. And before the break, I was going to talk a little bit how streamline things and where we can help you. So we just started using a software tool called RetireFlo. So if we send you a link in the email, if you're already a client or we've talked to you before, and you get this link for RetireFlo, that is something that is from us. And what it is, they call it a survey. And you click the link. You can do it on your phone. You can do it on the computer. And when you pop on that page, you're going to see my face, yay, and my logo. And so you know that it's, has to do with my office. And it's going to ask you to put in, a little bit of personal information. I wish it asked a little bit more, but because it doesn't ask for date of birth or your Medicare number, which is something that's very useful to us. That's something a lot of times we'll say, okay, can you send us that? But what it does is it will ask you your address and your email and phone number, so we can contact you. Big thing, of course, is your zip code. We need to know what zip code you live in to be able to quote your drug and Advantage or any of your health plans. We need to know what zip code you live in, and we need narrow that down. It doesn't, or actually, I think it does ask on. We need to know what county, because you can have a 38501 or 38506 zip code and not live in Putnam County. So we need to know what county you live in. It doesn't affect the drug plans. The drug plans are statewide, but if we're looking at a Medicare Advantage plan, it's very critical we know which county you live in. So that's something to ask. But anyway, it's going to ask you that basic information, and then it's going to have where you can add your prescription. And so you can do a search and type the first few letters of your drug plan, and it'll pop up which one you have. So that way it makes sure it gets spelled correctly. And then it's going to ask you what's your dosage. How often are you taking it? Is it one time a day? Is it once a week? Is it 3 times a day? And so we can put all the things. Those things can affect the cost. And then be very careful on some drugs have tablets and capsules. Make sure you pick the right one, because it can definitely skew the results if you click on capsule, and I've done it I don't know how many times. The biggest offender there is levothyroxine, the thyroid pill for those with low thyroid. None of the plans will cover the capsule, and it, of course, that's what comes up first alphabetically. So you see, 50 micrograms, click, and then you go back and why is it not covered? It's like, and like I said, I've done it myself. So that's one part. The other part will ask, who are your doctors? And if you're just wanting us to look at your drug plan, you don't have to answer the doctor questions. They're not going to apply. If you know you have a Medicare supplement and you're just reviewing your drug plans, who your doctor is not going to have any bearing on what we're looking at. You can skip that part if you want to, or you can put them in anyway, because sometimes people decide, let me look at Medicare Advantage. That may be something I want to switch this time. So you can do that, so it does. Then we do need to know your doctors. And then at the end, the last part, it's going to ask you to sign what's called the scope of appointment. That one is very critical. I had a client call and just want to talk to me. And I cannot talk to you about your Medicare coverage without having that scope of appointment signed. I have to have that permission to talk to you. And I have to have that permission 48 hours prior to giving you that information. So we ask you to, that's why we ask you, here's the link, go to RetireFlo, fill that out, do the scope of appointment, and then you can go and schedule an appointment, or we can fill it out. And generally, I will usually go ahead, once I got that signed, a lot of times we'll go ahead and kind of run the quote, put the prescriptions in. I don't have to wait the 48 hours to put the prescriptions in, and that's one of the reasons why we'd ask to get those ahead of time. We can do that at off times. I can do it sitting with my laptop and watching TV at home if I want to, and not do it when I'm trying to run appointments, because we get very busy this time of year. So it really helps us if you get that information to us and let us, do the research for you, and then come back and have a suggestion for you. And sometimes that suggestion is going to be, hey, I looked it over, keep what you got. I mentioned before the break, talked about that $590 Part D deductible. And again, most plans it's going to apply on Tier 3 and higher. But the unusual thing is a lot of your Medicare Advantage plans are having that deductible. One of the big things, because Medicare Advantage plans can absorb some of those prescription costs in other ways, and so they usually have, and they still are generally going to be a little more generous on your drug coverage. Maybe, standalone drug plan of Tier 3 would be a $47 copay, but on a Medicare Advantage, it's a $42 copay. Things like that. So just a little slight difference, a little bit slight savings. But it used to be one of the big deals was, hey, you didn't have to worry about the Part D deductible and pay, $300, $400 because you had to go fill Eliquis or Jardiance or Xarelto, those very expensive drugs that you see advertised on TV. You're going to have that deductible. So the other thing was that would be one of the reasons why to go with an Advantage plan. You don't have to worry about the deductible. A lot of the plans are doing deductibles. And most of the ones, if they are, it's not applying to Tier 1 or 2. It's going to apply to Tier 3 and higher. So your brand names, you can have that deductible. You pay that first. Now, that deductible does go towards that $2,000 max out of pocket. The ironic thing, I don't know if ironic, so just the counterintuitive thing, I've just did a presentation for one of my clients, and their issue was they had Xarelto and Jardiance, both very expensive, and been fighting, every January, yep, got the deductible. Oh, June, yep, here's the donut hole, and now I'm paying, 3 times as much as I was. A couple of solutions for that this year. One is, two of them are you pay the deductible and then you just pay the monthly fee. There's not going to be a donut hole, so you don't have to worry about that. The other is plans that have a higher premium. And this is why I always tell people, don't pick your plan just based on the monthly premium. Look at what the whole costs are going to be. Because for this individual, because of his prescriptions, we looked at a $95 plan and a $27 plan. And I'm using round numbers and not talk about the company. It would actually cost him more in the year if he took the $27 plan than doing the $95 plan. Beauty of that $95 plan, doesn't have a Part D deductible at all. You're like prepaying it in the premium. The other thing is the way they figure that $2,000 has to do with what it would cost you if you had what they called the Part D standard plan. So because of the way the pricing is on this plan, he's getting credit for paying more cost sharing, even though it's not directly on his drug cost. So his drug costs are only going to, only going to be like $680 for the year. That's the drug cost. And then with that $95 a month premium, he's going to pay about $1,600. If he had done the $27 plan, he would have had the Part D deductible. So he had to come up with $590 first, pay higher copays on those expensive brand name drugs, and the out-of-pocket was going to be like $1,800, $1,900. So even though the drug plan premium was a third as much, paying less money on the one that's 3 times more. And what's going to happen is, because of the way the drug costs are calculated, I think it's around April or May, he's credited with hitting that maximum out of pocket on the prescriptions. So now all he has to do is pay that monthly premium to the end of the year. So it's a little bit easier to manage. The other thing is, I talked with a couple this week, and probably going to hit the 2,000 max, have to deal with that deductible, and it's called M3P is what they're calling it, and it's a payment plan. And you can set up a payment plan with your insurance carrier. It's basically a loan or advance, however you want to look at it, but you do have to pay it. If you don't pay it, it can affect your credit. But you fill that out. You have that filled out. They're going to send you a payment plan that you just have to pay it each month. But you can divide that $2,000 over the whole year, which will be about $166, $167 per month. You go to the pharmacy, you don't pay anything at the pharmacy. You just go and you pick up your prescriptions because you're going to be billed directly by the insurance company. Now, again, if you're on a standalone drug plan, you're going to have to still pay your monthly premium. That's separate, but usually a lot of times most people have that premium coming out of their Social Security, so they're really not seeing it. They're just seeing a little reduction in their Social Security check. As long as you pay that premium, they cannot cancel your drug plan. Now, if you don't pay your payment for the payment plan, they can just say, hey, the whole amount's due, and if you don't pay it in a certain amount of time, we're reporting it to the credit bureau, and it's going to affect your credit. So I always say, pay your bills, folks. But the good news is you can budget your prescription drug costs by doing that payment. And you don't have to hit the 2,000 max. If you know you're going to have the deductible, you can still set up that payment plan with your carrier. Now, if you're staying with the carrier that you have now for next year, you can call that customer service number that's on your ID card. You can call them today, because we couldn't do it before the 15th, but you can call that customer service today and say, hey, I want to sign up for the M3P, or I want to sign up for the prescription drug plan on my plan for next year. And that way it's already set up so that when you go in January to fill your prescriptions, you're not going to have to pay anything at the pharmacy. You're going to get billed by the insurance company. If you change plans, you sign up for a new plan to start in January, then you have to wait until you actually get your membership paperwork from them, and that's usually around Christmas, because the annual election period ends December 7th, and that gives them a couple of weeks to close everything out, make sure that, yes, you are enrolled in such and such plan, and then they'll mail your stuff out. And some people don't get it. Sometimes it's closer to New Year's, or sometimes even after the 1st when they actually get those plan materials, your ID card, your membership book, all that stuff. So if you're going to a new carrier, you have to wait until you have that new plan in place or scheduled to go in place, and you have your materials to call them to set up that payment plan. So as I mentioned, a lot of the Advantage plans are doing deductibles on the drug plans, so that's something to look at when you're looking at plans. There are new plans. If you have a Mutual of Omaha Part D plan, you have to get a new plan. They're not doing any drug plans next year. So that one there, you need to contact us. If you got questions, you can call the office. Go to insurancematchmaking.com and say, hey, I want you to, you can just send us a message. I want you to look at my drug coverage, and then we'll send you that link for RetireFlo. I don't know if I email you, there is, actually, no, I don't know if I had that in my signature line either. I have how to schedule the appointments. I use a program called TidyCal to pick an appointment. But if you go to TidyCal, to my TidyCal link, which that is linked on my website, and it is also in the signature file on my email, that you can click the link, schedule the calendar, or schedule the appointment. When you go to that point, there's going to be instructions there, and there's going to be the link there also for the RetireFlo. So those are some ways that I can help you look at those costs. And like I said, the other thing is not on that. One of the reasons why I like to get your Medicare number, it doesn't tell me what plan you have. There's not a spot for you to say, hey, yes, I have this drug plan. So that's something you could email us with also, or call us and say, hey, I have Company X value Part D plan. That way we know and say, and then when it comes up and compare and say, oh, yeah, makes sense for you. Just go ahead and keep that plan. That's still going to be your lowest cost. And then you don't have to do anything, and you can relax. You don't have to worry about something changing on January 1st. But it looks like I'm running out of time here. I knew I'd ramble a lot. I don't think I covered everything I want to cover, but we'll get back at it next week. So until next week, see you on the radio.
You've been listening to Insurance Matchmaking with Matt Libby, your path to health, life, and Medicare coverage with Matt Libby Insurance.